Most clinicians believe that any device that is marketed as a bacterial viral filter must necessarily be capable of capturing any individual bacteria or viruses that might be suspended within an inhaled or exhaled gases. In this module, you will discover that this is by no means a justifiable assumption. The principles of aerosol science are explained here possibly more clearly than you've had them described to you before. If you find this information disturbing, we will have succeeded in our goal, because those who administer care to critically ill patients are well advised to protect themselves from falling ill themselves. This 58-minute presentation describes the testing methods that manufacturers employ to generate the often misleading efficiency specifications that are claimed for some of these devices. You and your clinical colleagues might unwittingly be placing yourselves at considerable risk of exposure to infectious microaerosols, endotoxins, and hazardous aerosolized drugs. But methods are available to dramatically decrease those risks. The time-honored axiom, first do no harm, is and should be applied to patients, but we must never forget to apply it to caregivers as well. We begin by examining the dimensions of several categories of particulates that might be found in an inspired airstream, and learned why the tubercle bacillus can be characterized as the most penetrable particle known to man. My initial interest in filtration arose from the requirement that we block droplets of ribavirin from penetrating the valve box of mechanical ventilators, delivering that virostatic aerosol to infants at Stanford University Hospital. After finding that a host of breathing circuit filters were incompetent to block ribavirin, we were forced to conclude that most of these so-called filters are totally unable to protect ventilators and the folks located downstream from those vents from being exposed to microaerosols. Much to our chagrin, we discovered that most filter manufacturers employ an archaic testing procedure that challenges filter media with particles that are many orders of magnitude larger than the microorganisms that populate the typical ICU. At length, we discovered a manufacturer that challenges their filter medium with individual bacteria exhibiting the same dimensions as the tubercle bacillus. The advantages and drawbacks of so-called heat and moisture exchangers, or HMEs, as well as heat and moisture exchanging filters, or HMEFs, are described next. An algorithm that can be used to select an appropriate humidification device for mechanically ventilated patients is presented, and the relative merits of electrostatically charged filter media are considered. Two physicians, Kern and Frumkin, happened to notice that a strikingly high percentage of the RCPs employed in their hospital department were afflicted with reactive airways disease, or RAD, and they proceeded to perform two studies that succeeded in verifying that RAD can, in fact, be considered an occupational hazard of RCPs. To the extent that we can protect ourselves from this hazard, of course, we are well advised to do so.